Hey, birth besties, you're not challenging your doctor, you're just asking for clarification. Let's talk about it. So, I want to tell you how to navigate the labor room or your doctor's appointments when you are pregnant and or going to have your baby. The first, I want you to understand that it is absolutely okay for you to ask questions. Ask away. I always tell my patients, you should feel good about the decision you're making, right? And part of that feeling good comes from knowing that you've asked all of the questions that are necessary for you to make the best decision. So, how do we do this? Most people feel intimidated by their healthcare providers. That's understandable. And to be honest with you, a lot of nurses feel intimidated by the doctors and APPs as well, advanced practitioners. But I'm here to tell you, you don't need to feel that way. Okay? Your doctor or your midwife is just a person just like you, right? We're all the same. And you didn't go to medical school or nursing school. So you're not going to have the same level of understanding that they have, which means you may not understand some of their recommendations and why. So, how do you get to the crux of the issue? How do you ask a question in a way that you feel comfortable and in a way that your provider feels respected, if that's what you're concerned about? It's really simple, and I encourage you to practice on each other if you have a support person or a partner. But say, hey, can you help me understand why you're recommending this right now? Okay? That's all you have to do. That question hits a little bit differently than why, right? And why can be off-putting, I guess, for some people, right? But it's really the same question. Can you help me understand? And that's what why does. So if your doctor is recommending an induction or that you come in 2 times per week for monitoring or that, you start Pitocin or whatever, right? Just say, hey, can you help me understand why you're recommending that right now? And they will receive that as, oh, she needs clarity versus as someone who's challenging you. And I'm not saying you're nervous and I'm not saying that you can't challenge your provider, but I know that keeps a lot of people from asking questions. Case in point, I'm a nurse. Doctors will come in, speak to my patients, and then when they walk out, I'll ask the patient if they understood and they'll say, no. So that tells me that people are a bit hesitant to question the doctor's recommendations. Also because they don't feel like they know and have the expertise that the doctors have. And that's okay, but you can still ask those questions and I encourage you to do so. All right, birth besties, I hope you have a lovely day and grab that free guide. Link is in the bio. Why aren't you?